Good morning, ladies and gentlemen, everybody that's attending on Zoom. First off, let me wish you a very happy holiday season and Merry Christmas. This is the December 8th meeting of the Mojave County Board of Health, and we're happy to be here tonight with you. We'll open the meeting with the Pledge of Allegiance, if you'll all stand and join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay, we have a call to the public. Is there anyone here that wishes to speak to the board during call to the public? I see none, so I'll close the call to the public. Denise, do we need to verify that we have a quorum?
Yes, please, if you wouldn't mind, because we do have some people participating by Zoom. So if we could do a roll call of those, maybe for all of us, we can do that.
Okay. All right, usually the clerk of the board does that, so.
Yeah, so I'll act as clerk.
So
I have a
would
new
you
role.
do the honors then, Denise?
Certainly. All right, so I don't have a list. I do have a list, don't I? I do have a list? I don't have a list. All right, I'll wing it. Okay, Hunter Adams, are you
Here.
Okay. All right, Sandra Thomas. She's muted. Thank you. Okay. Okay. Got it. Okay. All right, cool. Cal Sheehy.
Here.
Allison Fair. Okay. Marley Lucas.
Here.
Great. Nancy Mongeau.
Here.
And did I miss? Oh, and Curtis Manley. Thank you. And he is not here. Yes, he was going to be at a medical conference. So,
Okay, so we do have a quorum.
yes.
Okay, the first item of business to come before the board is a discussion of possible action regarding the update on our mobile unit.
Mhm.
Good evening. My name is Lynn Valentine. I'm the nursing manager for the health department. And I am here to update you all on an ARPA, which stands for American Rescue Plan Act of 2021 funds project that is actually part of our county supervisor, Jean Bishop's district, part of her funding that she received. And she has put approximately almost $1.4 million towards a mobile health unit that will serve her district, District 4. The mobile health unit will provide medical screenings, health education, linkages to care, and referrals to social services. And the idea is to target those rural areas where they have limited access to services because they're greatly needed. We are an underserved medical community. Some of the preventive health screenings I have listed there on the document in front of you. They will include blood glucose screening, cholesterol, hepatitis C, the sexually transmitted diseases, HIV, and offer COVID testing and flu testing. We also will be offering vaccinations for adults and children. We'll also have some treatments for those sexually transmitted diseases as well. The linkage to care is an important component, once again, because of the rural area that we'll be serving. And also, we don't want the mobile health unit to be take the place of a primary care provider. That's not what it's intended to do. It's really to get these people in, have them seen, get them screened, and link them to care so they can be treated for anything that is necessary for that person. The mobile unit is a 22-foot Ford Transit van, and we're really excited about it. It has worked closely with procurement and did a competitive bid process, went through a competitive bid process. And the mobile unit will have a laboratory in there. We'll have an exam room towards the back of it, and a waiting area. So Denise and some other individuals with Fleet, with our motor pool, went and looked at a North Country Healthcare's mobile unit and got an idea of what we could include. And they really helped us and talked about the things that would work well and what didn't work so well. So that was very helpful. So it's expected that we will get it on or about April 1st. We will staff it with a nurse practitioner and a medical assistant. So we're really excited about it. We're still working on exactly how the scheduling is going to work and, how the logistics of everything, but we're really excited about it. And that is where we're at in the process right now. So hopefully we'll, eventually be able to take you all on a tour in the unit.
Okay, Lynn, I understand it's going to be wrapped with the Mojave County logo.
Yes.
I saw a draft of that and it looked really, really professional and nice.
Yeah.
So thanks
Yeah.
for doing that. Do you know, does it have an awning on it?
Yes, we did request an awning.
And does it have exterior speakers so we can play some nice music while people might be standing around waiting for their opportunity?
I don't remember if it has.
I don't think it
external.
does, but we can certainly look into that. Yes.
Yeah, well, of course,
Yes.
Denise knows that I've been looking at camper vans, so
Oh, is that what?
along the lines of that,
Mhm.
those are some nice things to have.
Yeah.
Okay, well, I'm certainly happy to bring our first van of this type to Mojave County, and I'm really hopeful that the other districts will see the value of it and maybe later buy into the project and expand it to other areas of Mojave County, because District 4, even though it's a very large, remote district, I think there's plenty of wealth to share with what this van can bring to the communities.
Absolutely.
Okay, thank you, Lynn.
Yeah. Madam Chair, I have a question. Will it only be used in District 4 then, or will it be able to go to other districts?
Right now, it's just limited to District 4. I've asked Supervisor Johnson if he's interested in bringing it down here, and he hasn't said no, but he hasn't said yes. So
Okay.
I'm hopeful that he will buy into the concept.
Okay. And then what about the Department of Public Health has funding for the practitioner and the medical assistant to operate this on an ongoing basis?
Yes, so this was included in the overall projection of costs that we submitted when we requested the funds through ARPA and through Supervisor Bishop.
And that will be funded for how many years?
I think we've got it for 3 years approximately. If you look at how the funding can be allocated, I think it can pay for it for 3 years out. And if not a little longer, I know that they were looking at getting those funds extended.
Yeah, great.
And then at the end of that time period, the health department will evaluate how effective it's been and whether or not we want to continue with county funding to continue it.
Yeah, great. Yeah, thank you.
Yay, Merry Christmas.
Yeah. Madam Chair, if you wouldn't mind, Lynn was being very humble. She actually did a lot of the interior design of the unit. I mean, she had to scratch it out and have it all outlined so that she could tell the vendor exactly what she was looking for based on the meeting with North Country and our conversation with them about what worked and didn't work. So I think as a result, we got a lot of the changes made and a lot of the amenities that we were really looking for that'll make it a lot more comfortable and functional for everyone involved.
Okay, we have the list of the preventative health screenings that we're going to be doing with this van. Are there other things that we may do later if the demand presents itself? Other things that you've thought about that maybe may come later?
I would say possibly, yeah. I mean, we would like to, offer as much as we can. So I don't know what that would be off the top of my head, but I'm sure there will be things that we definitely could incorporate if the need was there.
Okay, so along with vaccinations, I'm assuming we're including COVID and flu vaccinations?
Yes. Mm-hmm.
Any other type, childhood vaccinations for school purposes?
Yeah, it should be our childhood immunizations across the board. I mean, all the CDC recommended vaccinations for children.
Right.
The adults, we have most of the vaccinations available for adults as well.
Okay. Well, I think you've done a wonderful job. I'd like to take delivery of that van before or after April 1st, but not on.
Yes, yes, good
So
point.
if you could work on that. Any other questions, comments? Okay.
I have a comment really quickly. I just wanted to emphasize my support in that, you know, these mobile units can do so much good with public health, but not to replace primary care, you know, having a medical home. And so if I may emphasize that on these buses, if you can create those warm relationships and try to find these remote residents, primary care, just medical home, I think that would go a long way for these rural communities when the bus is not there. So to create those longstanding relationships would be great value for some of these remote places.
Okay, and just so you know, Hunter, if during the redistricting process, if the Arizona Strip ends up being part of District 4, that would allow the van to go up there and serve Littlefield and Colorado City and everything. So that's a possibility. I doubt that that's going to happen, but it's a possibility. So.
Yeah, thank you for that. And North Country's great. If I may, too, I have the list of mobile services. North Country also offers, they actually come up to our area to do mammograms. And so cancer screenings could be one, maybe that we don't offer right out of the gate, but especially trying to screen for breast cancer in those rural areas. We've actually already had quite a few positive cancer tests in our area thanks to that. And so mammography may have additional equipment and it may not be feasible, but something to keep on the back of our minds as this progresses.
Absolutely. Okay, thank you, Hunter. Any other comments, questions? Okay, I don't believe we need any action on this. It was just more informative, so thank you for that. Next item is a discussion of possible action regarding communicable disease report. And then would that be you?
Anna's going to take over
Anna.
that.
Oh, that would be me. So I'm Anna Scherzer, epidemiologist with the County Health Department. And this is probably the least exciting communicable disease report I can remember. Yes, we've had cases. Things seem to be pretty normal, nothing out of the ordinary. It wasn't even worth putting together a flu report because we've only got 5 reports of influenza. So that wasn't even worth putting together a graph or anything. There are some things that we're seeing, some trends here and there. With pertussis, we've seen fewer cases of pertussis during the first 3 quarters of this year compared to the past couple years. But that's one of those diseases that will kind of come and go. So pertussis is important when you have an outbreak or a big cluster of cases in a school or something like that that you're concerned about. Otherwise, it'll kind of come and go. So that's not too alarming there. The influenza numbers and the RSV, the respiratory syncytial virus numbers, were down pretty low, but keep in mind this was the first 3 quarters. This is up through September 29th. So one would expect fewer cases during the summer months and whatnot. And I can tell you since that point, they are going up a little bit. There's probably still a lack of reports that are being made because of all the other important business that's being done, but I think we'll see those numbers go up a bit over time. And the salmonellosis, you can see that there's only 4 cases that were reported in this time period compared to the past couple of years. And, you know, there's really nothing to address there. It's just because that's the way it was this time. In the past couple of years, I believe there were a couple really small clusters, not that we owned or we had, but we had a couple cases that were associated with those clusters. So maybe that's why those numbers were a little bit higher. But aside from that, you can see that a lot of the COVID investigation and COVID reporting and all of that is really what's driving a lot of the basic work now. Are there any questions there in any of that?
Any questions? No questions.
All right, thank you.
Okay. Next item is discussion on possible action regarding the update on the telemedicine presentation.
Yes. I'll kind of take over this one. I did reach out to the University of Arizona telemedicine site, and they are working with us to plan for a presentation at our next board meeting in Kingman. In large part, when we talk about these presentations, we're unsure of what technology is available sometimes, and so we want to make sure that they have all the that we have all the proper technology in place to be able to provide that for them. So we will be working with them for a presentation at the next meeting.
Great. Okay. Any questions? Going on to the next item. This will be a discussion of possible action, reference the ChaChip update, the role of the Board of Health.
And that will be me. Hi, I'm Barbara Hartnett. I'm the Special Programs Analyst for Public Health. I'm just going to give you a brief update on our Community Health Assessment, the CHA and the CHIP efforts that we were doing this year. Just a quick overview. We did 7 community meetings in late July and early August. We created a new mini chip, which is included in your packet. The mini chip is just an overall highlighting of the findings of the 77 community meetings. There will be a larger chip for Lake Havasu, Bullhead City, and Kingman. There will also be 3 smaller chips for Dolan Springs, Golden Shores, and Colorado City. Substance abuse was identified by all the big cities as a health priority, as well as mental health and healthy living, which is access to healthcare services. We created the 21 through 23 CHIPS and the 2021 CHA from our 7 community health meetings. And the CHA is being finalized now, will be available for distribution in early 2022. So we're just working on the details and getting it all cleaned up, and we'll be ready to share that with everybody early next year. And the Board of Health can help us support our efforts by promoting the community health assessment, participating in community meetings, and the CHIP work groups that will be held throughout the next few years. We'll be meeting with the community and helping them meet their health goals that were identified during those community meetings. I wanted to give you a real quick overview of what's going on with our reaccreditation work as well. We submitted nearly 200 documents and narratives November 24th to the FAB Review Board, which is the Public Health Accreditation Board. We are awaiting their review of our documents and our narratives now. We anticipate within the next 3 to 4 weeks, they will schedule, well, they give us their feedback first, and they give us a chance to answer any questions they may have about our documentation and narratives. And then they'll do a virtual site visit where they'll interview us and ask us more questions they may have. And then they will, within about 6 weeks, they'll make a decision on whether to reaccredit us or not. But I'm very confident we'll be fine. So, and that's all I had. Any questions?
So just to add to what Barbara's provided so far is that I guess I would also like to ask if the Board of Health has any ideas on how they can be involved in the CHA and the CHIP work. The CHA itself will be primarily data-driven and informs the CHIP process, of course. But, you know, when we talk about implementation plans, most of those really need to be community-driven in order to be successful. And I would like your feedback on how to involve you more in that process, and how we can be more involved in your work towards that, realizing that we may not need to lead efforts per se. There may be already community groups involved in all of these activities, and we can participate in those. So we can take on a number of different roles. But just trying to get your feedback on that. So I just want to open the floor for that question and see if you have any thoughts on that.
Denise, do you know how other board members act in other counties, perhaps?
You know, I think they vary by county, honestly. You're going to find some boards of health that are very actively engaged in all of their health department activities. And you have some that have very limited roles, and either that's by choice or by direction. So in this particular case, I feel like where we can be most successful is working with the communities to implement their plans. In Colorado City, Golden Shores, and Dolan Springs, those particular areas, the work that we did wasn't in the development of a formal CHIP for them, but it was identifying some of the issues and concerns that the community had, and then looking at how, and the next phase of that would be the community coming together to actually develop that CHIP. So that would be the next phase that we need to work on with each of those communities, realizing that really it's a community-driven plan, meaning they're the motor behind it all. They're the ones that really need to do the work, but really realizing that we want to support their efforts and we want to connect them to resources that can support that mission as well. But we'll have to, we're not the end be all end all of all of this. I don't think most people would feel like having the health department come in and just do it would be helpful. Really getting that community buy-in will be kind of what drives the process home.
And I can tell you too, the rural areas that we visited, they really appreciated their voice being heard. They felt like they didn't want us telling them what their problems or issues were. They wanted to tell us. And so Colorado Springs was very appreciative to be able to voice their concerns. And, so that was part of it, of them, not us coming in and running it for them.
Mm-hmm.
Yeah, I can't tell you how many times I hear from some of my rural communities that they feel like they're the stepchildren of Mojave County, that nobody cares about them. So it's really great to have that interaction and let them kind of control the information that was being given out.
Yeah, and Colorado Springs felt like they've not had a voice for quite some time. So we've been in touch with them since we met with them in August. So, yeah, good relationship going there.
Yes, Nancy.
Yeah, if I can make, if I could make a comment too, speaking from Colorado City, it was a great experience. I do have a question on the CHIP itself. So in the board packet on page 2, there's a couple of items that kind of stand out to me as countywide needs, which would be services for seniors and services for veterans. It looks like every community that gave answers said that those were kind of high need areas. So that I feel like could maybe be like a county-wide initiative, whereas there's some other ones, like in Colorado City, for instance, adult dental care made the list. The nearest Arizona dentist office is about 75 miles away from our community. And so my question, as the CHIP gets developed, is it county-wide? Is it supporting county-wide initiatives, or is it community-based? Or is it both? And how can we kind of be in the driver's seat, and what resources could we, as a rural community, kind of expect as part of this process from the county?
So great questions, Hunter. So I think some of the plans, so looking at Lake Havasu City, Bullhead City, and Kingman, they each will have their own plans. And then the idea would be that Colorado City, Dolan Springs, and Golden Shores would also have their own plans that they can own, basically, and then they can work towards some solutions. As far as the health department, where we can assist, we certainly will, but again, we don't have all the resources either. So we may have some knowledge of resources, we may be able to work together with the community members and with other agencies within the community to identify and secure other resources to address those concerns. So it's sort of both ways, right? They're running parallel paths. We'll continue to work on the actual plans with the communities and get them involved. But we also need to work with the smaller communities in actually developing a CHIP and then empowering them really to work within their communities to resolve some of those community health problems.
Thank you for that.
Certainly.
Okay, Nancy, did you have a comment or a question?
I found that. Okay, can you hear me now?
Yeah.
Can you hear me now? I find that in the communities I've worked at, there's a lot of nonprofits that are working towards the same thing, but they don't know that they're working towards the same thing. So one of the roles I see for all of us here on this board is to maybe help figure that out. And if you're working on a mental health and you're working on mental health and you're working on mental health, what are you doing that's the same? And maybe spending money the same way that you could collaborate and deal with some of these big issues like substance abuse, mental health, and healthy living together. Because there are programs in TOPOC
Yes.
that the people of TOPOC don't know exist. I know, because every time I go to a meeting and I say, well, you guys know about, and they go, no. And that happens in Fort Mojave Valley, Bullhead City, in Golden Valley when I've gone to talk to folks there. It's amazing how many of our nonprofits may be working on the same issue, but don't know that they're working on the same issue. I think that's where we could come into play. So
Okay.
I'm just,
And just so you're aware, Nancy, there's actually a mental health resource team that came out of one of these community health assessments. And we've got groups from Bullhead City and Lake Havasu and some lost groups. So we actually do have a coalition of about 80 to 100 people, and we are starting to all work together. And we are finding that we are working on some of the same things. So we do have a group that's doing that now. So I hopefully will have
and
all our resources lined up. Yes.
And I knew that. And I didn't mean to use mental health as the
No
example
worries.
because I knew you guys had done that. But
But we hope more coalitions will come out of these CHIPs and CHAs. Yeah, absolutely.
Right, right.
So it's my understanding that we were putting together an informational brochure with all the different benefits and nonprofits and, different places you can go
we're
for help.
putting together a resource guide, and we're actually
That
finalizing
was
that
what I
now.
was
Yeah,
searching.
we're working with IT to get that up on the Mojave County website, but then we're also going to help, distribute it to other, other entities. But
That would
we
be
have
really
to,
handy
we're
to
working
have
on the
in the
formatting.
wellness van to be able to hand out during those
Yes,
visits.
absolutely. And we're working with IT to get that up pretty quickly. So
I know the Meadview put out a brochure on all of the different food banks related to St. Mary's. And it was even eye-opening to me, and I'm one of the directors of the Kingman Food Bank, to see how many other food banks there are around the counties. That sort of stuff, everybody's doing the same thing in different areas, and it's nice to see that where they all are.
Right.
Yeah, Madam Chair. In Lake Havasu City, we have the Community Resource Coalition, and we can open that up through the CHA and CHIP process. So we can have you guys be on the agenda. We basically bring all of the organizations together twice a year, sometimes 3 times a year. There are all the social service agencies, all the nonprofits, all of the economic development agencies, education, transportation, all in the same room to have those conversations. So we can open that up, and that might be a good avenue to create advocates to help support it and the mission within our community.
oh, absolutely, that'd be great.
Okay.
Yes.
Okay, any other comments before we move on? Okay, the last item we have is discussion, possible action regarding the Board of Health support for department mission.
Right, and this sort of circles back to that question about how involved the Board of Health is in our work. I think at this point, I would like to open it up to see how you would like to be involved in our everyday mission work, not just around the CHA and the CHIP. As an advisory board, we certainly respect and look for your feedback and comments on our work and what you hear in the community. But I don't feel like we've really utilized this board to the degree that I think we could and or should, right? And so I guess I'd like to open it up to all of you. I know many of you have other jobs and careers that you're working on, and this is an additional responsibility basically that you take on. But I also would like to get that level of feedback where you can tell me if there's something that we could be doing differently or how to involve you differently in our work. And I know Hunter has brought this up a couple of times of how best can he participate in this. And I don't know, Hunter, if you've had any thoughts or how you use your board for your FQHC up in Colorado City area.
Absolutely. And if I can comment really quickly on the health department. So as you mentioned, Colorado City, we're separated by the Grand Canyon from the rest of the county. And so, we're about just over a 5-hour drive from where you're sitting right now, yet we're in the same county. So I think just distance, geographical distance from like the main bodies, if you may, of Mojave County does separate us both geographically and culturally. But I do think even in the last 2 or 3 years since starting the clinic up here, creating the connections with the rest of the state and with the rest of the county goes such a long way. And looking at the CHA and the CHIP, there's a lot that came to that mind that reminded me of kind of the conversation I had with the Mojave County Parks Department. And so I think that, the Board of Health is one arm of a county that is so large and that can do so much good in so many different communities. So I think one thing that we could do maybe is just collaboration, really understanding. I think that resource guide will be so helpful in knowing, that like organizations like North Country can do mammogram bus services. We would not in our rural community have access to any mammograms if it weren't for that connection. And so I think just keeping in mind ways that we can collaborate with one another and make sure that rural voices are heard, and also that we're addressing things that are countywide. It's nice to know that, veteran services are not we're not the only ones that are trying to solve this problem. And so if we can piggyback off of services that Bullhead City or Kingman are doing, then I think just together we are stronger as a county. And so together, meaning geographically and across all of various communities, and also across the various departments of Mojave County and across the state. I think if there are other areas of the state that are doing things really well on the public health side, then, learn from and being able to develop those connections. So I think it's kind of a long-winded answer to your question. Sorry, Denise, but just really having connections to the rest of the county and the rest of the state is probably, it's single-handedly changed the culture and the feel for our community, which is amazing. And to answer your question about our nonprofit board up here, they all have interest in bettering our community. And so I think if we can just have that shared mission, and I feel very supported by the board, and that, the board feels very supported by the staff, and just to recognize that at the end of the day, we are all on the same team and that we're working towards the same objectives, and just clearly, stating our mission and what we're trying to accomplish. Thank you.
Thanks, Hunter.
Good points. Thank you, Hunter. Okay, anyone else?
Nancy, any thoughts?
Denise, where do you see us? What do you want? What do you want from me? No. No.
Hey, Denise.
If somebody said to me today, what did you do to help the Department of Public Health this week? And I said, I didn't say anything bad about them.
Thank you.
Because I love you guys. But you know what I mean? I
do.
What do you want? Where do you see us?
Well, and I think I've been trying to create a vision for this as well, because your time is valuable, and I realize all of you within your respective roles in your community have an opportunity really to impact our work. And where this all came to light really was in talking about the COVID response, right? Of have we really utilized our Board of Health members in our response, and what would that have looked like? In many ways, we see you as advocates out in the community for public health, right? Not just for our department, but public health in general. And in any way possible to look for, if there are issues or concerns that you bring those back to us, and that we try to work with you on addressing those and bringing in other key partners really where we can't impact it. Maybe there are other people that we know of that can. And we've sort of operated on an island with this COVID response, I think, and most of that has been a public health role. But I do think in in trying to expand that out, are there any kind of advocacy things that you'd see us working towards together? I know in my previous role where we had a Board of Health, we worked on texting while driving laws. And granted, those are old and those are in place, but those were things at the time that were, everybody knew the dangers of it, but there were no ordinances, no structure there to, and no penalties for doing so. So, you know, just looking ahead like that, if there are things that we can be involved in where we have programs or staff to offer, we'd like to participate in that process. But thinking about how do we get to public health, and public health is often a policy-driven approach where we can impact the greatest number of people with what seems like very practical and common good type approaches, but they take a little bit of work and they take time to do. So that's one aspect of it. But yeah, are there any other ideas?
Denise, do we have any way of tracking proposed legislation that has some kind of an effect on public health? Maybe we could make that information available to the board and teach us all how to use the request to speak down at the state legislature, so we can log on and make comments opposed or support of various things that come up, because our legislators, they come up with a lot of things that get weeded out as the process goes along, and we could be part of that process.
I'm thinking that during this whole COVID pandemic, you must have gotten some very interesting phone calls at public health. So I think you should write a book, and we should all sell your book, because I've heard some stories. But
Might be therapy.
But seriously, I'm sure that you at one point got the same calls over and over and over and over again from people who were panicked or alone or just didn't know what to do. I know I was one of them. And I'm a nurse of 45 years, and I still called and said, hey, I need your help because I have a problem in one of my sober living facilities. So, and you were fabulous. I mean, I could write a book about how fabulous the nurse was who came and took care of the issue at the sober living house, so that we didn't have a problem with the entire house. It was absolutely fabulous. But so I'm thinking that I think a lot of people don't understand the role of public health. They don't at all. And they don't know what a valuable, valuable resource all of these people sitting at this table are for our county. The fact that one of the first times I ever came to a meeting, you were talking about a food poisoning where 5 people had died, and an epidemiologist was running to, I forget the name of the community, but it was way out there, and trying to figure out where it came from. And I remember that distinctly thinking, oh my word, I had no idea.
Would have been Anna.
Yes, was you, Anna, wasn't it? I know. Yes, it was cow. Right. So, but it was amazing to me, and like I said, I've been in the business for 45 years, but the role of public health is not discussed, except when you have to tell us something we don't want to do. And it's so much bigger than that, isn't it?
Right.
So.
Yeah, and that's a great point. And we can work on doing some education and providing those resources out to you, and maybe you can share those with your
That's
folks.
what I'm thinking.
Yeah.
I'm thinking if I had the information and knew how to, then I could make sure that the groups that I deal with understood your roles better too.
Yeah, and that's actually become crystal clear during this pandemic, because people call and say, well, why aren't you doing this? We have no authority to do that. And we don't step beyond our authority.
And I've said that many, 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 many times to many groups when they said, Nancy, you're a nurse. Yes, I am.
Right. Yeah.
But we can't do it all. And we can't do things because the law says we can't do things. And they never understood that. So
Mhm.
that is definitely information we need to get out there to the public. And if we can help in any way, and if there's something going on that we need to spread, use that email
Okay.
and get it to us, because I'd be more than happy.
Reach out and tell us what we can do to help you when the need arises. And it may not arise that often, but I think all the board members would probably be willing to follow your direction.
Great. And to your question, Supervisor Bishop, Chairman Bishop, about whether or not we get any kind of legislative reports, the Arizona Public Health Association does update us on legislative issues. So in the future, what I'll do is I'll send those to you. And Will Humble, who was a previous Director of Public Health for AZDHS, he provides a summary of each one to give you a sense of what direction it's going and sort of the pros and cons. And so he can at least give you that to the point where you can probably make a decision about what direction to communicate to our legislators.
I would love that.
Then I believe there's a tutorial on the CSA website. If you've never logged into the request to speak, it tells you how to do that. And it's pretty basic and easy to do.
Oh, great.
And-
Good.
Okay, and we talked about COVID a little bit. I wanted to let the board know that the jail came back with only, I think, three positive inmates that are still in isolation. Everybody else came back that were isolated and they're negative. So,
The jail commanders and the jail as a whole, they've done a tremendous job to control that in their facility. It's really been remarkable when you consider any of these congregate settings and how difficult it is to try to move people and contain something within a small space that moves very quickly in a small space. So,
Madam Chair. Also, Denise, you might be able to use this only if this is helpful to you in the department, is obviously having more information is valuable. So you could use us maybe as a conduit for leadership development of your team, bringing those that run the different various programs throughout your organization to the board, giving them the experience to present and speak and advocate on behalf of their program and take questions for us. And then we'll also still be learning about what that program is to then be able to advocate throughout the community.
Great.
Again, only if it's helpful. I know that can be very daunting, but
no, that's a wonderful idea.
Yeah.
Very much so. And I was remiss because I meant to introduce Brian Scott, who's in the audience right there. Brian Scott has just, he's been, how long? 2-3 weeks? A month? Okay, all right. He's our new Public Health Emergency Preparedness Coordinator. So I don't know if you can come up and talk a little bit about your background. Thank you.
Pleasure to meet all of you. And I'm Brian.
just make sure that microphone.
See the red dot there?
Yeah.
Yeah, there we go.
There we go. Okay. My name's Brian Scott. I have a background of about 40 years in emergency response. I was a firefighter, captain, battalion chief, and fire chief in the fire services, both in California and in Alabama, and have done a lot of work in disaster preparedness through my agency in California for about 25 years. I was their director and then did some back in Alabama as well.
Welcome.
Yeah, welcome.
So it's a pleasure to be here. It's a pleasure to serve.
we're very happy to have you with Mojave County. Thank you.
I'm happy to be here. Thank you, guys.
Great. So I've taken some notes. I appreciate, and did we capture everybody's thoughts? I just want to make sure that we've, before we move on to any other agenda items that we've.
One thing I wanted to mention with the county is just the value that access can have in remote towns. You know, we look at counties and the cities that are well incorporated and have the food banks, have the social services, have the hospitals, have the safety net clinics. they're doing okay. But I think this mobile unit for District 4 is an amazing step in the right direction to reach the people that don't have those services. And so I kind of look at the county as almost as a safety net to make sure that people don't fall through the cracks when it comes to immunizations or when it comes to public health emergencies. So thank you. I applaud you and your entire team for all the great work that you're doing. But I think access is a huge buzzword in my mind for what this board could accomplish.
Great. Thanks, Hunter.
Denise,
Yeah.
can I just comment as well? At one time, the Department of Public Health did have a PR person designated to do just public relations, whatever campaign you were touting, whether it be vaccines or now you still have that role, correct?
Barbara has been acting as our public information officer, but she's also been pulled in many different directions.
Right,
then,
understood.
Yeah, and then at the same time, the county hired Roger Galloway to be the communications director. So generally, all the public relations materials go out through him if it's going to go to local media. And then Barbara here is managing our website, our health website, which she's working with IT on now, in addition to our COVID response hub. So she's updating the numbers when we get new reports in, and then updating Facebook along with Melissa Palmer. So
super. I just think that part of access, as Dr. Hunter is talking about, in those rural areas and in Fort Mojave and Mojave County and all of those areas, is that they know what public health is doing, which is exactly what Nancy is talking about, and that we care about every individual. Mm-hmm. And we count every individual as someone important. And that may be a refresher campaign about what public health does and how they can transform a community. I don't exactly know, but it might be time for something like that. Great. You know, a raw public health campaign.
I don't know if it's
So we could all be involved in that.
yeah,
yes, we could all be involved with that.
Kids.
And we're not talking just nonprofits, but religious organizations as well that do a lot of great work within the communities. And maybe that's how we can help, is we divide those nonprofits up among us and say, hey, I don't know if you have this information about public health, but we want you to make sure that your membership knows this. This is information that public health is doing for you and for your members.
That's great. That's a very good suggestion.
And we have to remember that all of our communities are part of Mojave County. We are united as a county, and we need to remind people of that rather than having 5 districts.
Yes.
Right.
You know, we should be a county first and then individual districts, I think, second.
That's right. And if we could do something with kids, you know, notes I hear, you know what I heard from my kid today? Blah, 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 blah is going on. I didn't know that. We actually shouldn't forget the young people, because if we can teach them at that age what public health is, then we won't be having these discussions.
Right. Very good point.
Yeah.
And Melissa, I don't know if you can speak to the position that we're currently recruiting for that's going to do some of this outreach work. Would you mind?
We are currently recruiting it's a community health education specialist. So they would be doing outreach and education, but also helping Barbara and I manage the social media jungle out there, and our staff with some of getting the message out of programs, information, opportunities, events that are occurring.
Super. Yeah, you almost need that dedicated resource that way to be able to spend their time, you know, looking at social media, seeing how they can go to other sites and add some of our activities to them to promote, and kind of stepping outside that box a little bit, but recognizing it does take time and energy to do that. You need somebody sort of committed to it and with the skill to write as well. That's the other the other piece to it for certain. So,
Yep. Hi, Denise. Can you hear me?
I can. Yeah.
Yes. Hi. The part I'm glad we have, looking for support for the community. I think the next, after 2 years of pandemic, I think the next big topic is depression, anxiety from, just social media with what going on that we all endure. I think all of us have a little bit of PTSD after this. So if we could have, as a physician, I think we actually, for the future, we actually need a psychologist, a counselor, to be part of the team to help us, promote the mental health for the teenagers. They got bombarded with a lot of stuff, and we all know, social media, a lot of controversial stuff going on, and the pandemic. I don't think that helping all of us. So if we could, beside the medical condition, I think psychiatric, depression, anxiety, PTSD, that's the major part. And hopefully we can focus on that a little bit more. It's always, since medical school, I never really thought much about it, but it is an important part of healthcare.
Great. Thank you, Dr. Nguyen.
Mm-hmm.
Yeah, great point. And I think we've seen that those issues grow exponentially in the last couple of years. So.
Right. And I think the person who can help us is a counselor, psychologist, psychologist more than a psychiatrist. So with the mobile unit, you have a nurse practitioner, an MA. I think it'd be someone with a skill set of a counselor or a psychologist would do tremendous benefit. You don't need a laboratory. You don't need to have, an IV infusion. You can sit there and counsel and talk to somebody. You can really help that person and a lot of people, the whole community. And if we can use PR to help that, public health, I think that's very important. And I was raised and trained to just give medication. But I think at this point in my career, I think talking to somebody is very important, especially now.
Great. Thank you.
Great. Any other comments? Okay. Does anybody have anything they would like to see on the next agenda?
Jane, did we approve minutes?
No, we did not. Is
You're
that
right.
on the agenda?
It wasn't on the agenda.
But just
Yes,
maybe next time we have to improve.
we will. Yes.
We'll put that on the next agenda. Thank
Thank
you very
you.
much. And then Denise, do you think there would be any value of sharing the PowerPoint presentation that was given by the KRMC at our last board meeting?
We can certainly do that. I think we would look to update it as well, because by the time we have our next meeting, I'm sure there'll be additional treatment options available to the public, in hospital and outside of hospital, I'm certain. So we can certainly do that. And if, based on the comment that was made, is there a particular program that maybe you'd like a presentation from to learn more about that particular program?
The most neutral program that you have that's exciting would be a good one to start with. That'd be a good program that we could get out there and champion without.
Yeah, exactly. Yeah. Good comment.
Well, how about if you have some thoughts, feel free to email me. In the meantime, we'll work with some of our program coordinators to select a program to present to you, so you get a little bit more information about what they do, where they work, and they may be able to ask some questions and get some feedback at that point as well.
And then we'll have the telemedicine presentation.
Yes, telemedicine.
Well, a couple of years ago, we did vector control, and I think that people found that pretty interesting. And with the pandemic, of course, kind of overshadowing everything that's happened in the last 2 years, we've had some interesting things in Mojave County with regards to our mosquito populations. So that might be something we want to chat about a little bit. Perfect.
Yes,
It'll
yes,
be
it
April,
probably
and
is.
we'll be setting traps.
Yeah.
Started. So
Yeah, and our goal this year is to do more prevention work ahead of the mosquito season, because Ron can certainly speak to it more, but West Nile virus is fast approaching, and it's actually here, I'm sure, but our number of cases are pretty low. But I think, trying to educate the public again about how to prevent mosquito bites and mosquito issues would be very helpful. Okay.
Any other thoughts or ideas before I adjourn the meeting? Going once, going twice. This meeting is adjourned. Thank you all for it.
Thank you all.
Thank you.
Thank you.
Thank you.
Thank you.